Hi, Professor Michael Terence. Nice to see you again.
Hi, Casey. I'm pleased to be back.
Yes, me too. Today we got a very special occasion relating to psoriasis nail. Can you tell me a little bit about that, Kay? Go to the picture.
Yes, psoriasis of the nail is not very common, but still there are a good 15 to 20% of psoriasis sufferers who have nail psoriasis. Nail psoriasis is a type of psoriasis. There are three main types of psoriasis. There's psoriasis of the skin, there's psoriasis of the nails, and then there's psoriatic arthritis, which is a psoriasis of the joints.
Yes. Can you give me some more information about the triggers that they have nails?
Yes. This particular patient, the main trigger is stress and mental health. She's had a lot of problems growing up. She's had anxiety since being a child. So she's grown up in an environment where there's been a lot of stress and a lot of pressure. So much so that she attended work for a little while but had to give up because she couldn't keep the job because of the stress. So there's been a lot of family issues at home because obviously her parents, when she was younger, put a lot of pressure on her to go and work, not understanding the full consequence of how her anxiety was affecting not only her psoriasis but her work ability.
How about a nail technician? Is that bigger?
The nail technician can help because with psoriasis of the nails, the symptoms are very thick nails. The nails are very thick. Sometimes they're very hard to cut.
Wow.
They're very hard, and there is discoloration of the nails. And we also get pitting of the nails.
Yeah.
Pitting means there are little holes in the nails. So these are just the different symptoms that nail psoriasis can present with. A nail technician certainly can help them to cut the nails a little bit. And sometimes they paint the nails to kind of cover up, yes, because they get embarrassed with the nails, the way the nails look, yeah.
But this one just for beauty, but just have a look this case. Can you tell me like before, when they came to the clinic, what they had to use?
She has used a lot of different products, a lot of treatment from internet. They use a lot of internet treatments. Her doctors have given her treatment in the past. And she hadn't got a lot of good results from it. And it's been continuously, her nails have got worse and worse and worse. Interestingly, with nail psoriasis, in a lot of cases, they also get arthritis at the same time, so their joints can also get inflamed.
And then when she gets to your clinic, how did you treat her?
Well, when we started treating her, obviously we had to look at triggers that are flaring up her condition. Obviously, in her case, psoriasis, anxiety, depression plays a big role. So we had to do something about that, look at treatment methods to cater for her depression. So she went on some medications to cater for that. She was already on some medications for depression, but sometimes some antidepressive drugs can cause psoriasis, can cause a flare-up. So it's important to know which type of antidepressive drugs that the patient can use. Obviously, if she's depressed, she has to be treated, but you have to be careful on what type of treatment she's given. So we had to monitor that treatment for her. And of course, we gave her some products to use for her nail. We gave her a special cleanser to exfoliate the nails. The thick skin underneath the nails had to be broken up first because otherwise no treatment goes under the nails. It's too thick and hard. So we had to do that first. And then we gave her a product called Nailinex for nail treatment. So there's a lotion and also there's a cream that she used. But we gave her also some herbal formulations to use.
But especially for, I think, if they have the nail psoriasis, if they apply the cream, cleansing gel, so is that hard for them for the work, for everything every day?
Well, look, it's sometimes a little bit difficult. It depends what kind of work they do. If they've got work where they're handling papers, sometimes they feel a little bit embarrassed. But also if you've got ointment on your nails, it might feel a little bit slippery. But, these are cases that are difficult cases. So the patients, we have to work with the patients, but the patients, more importantly, have to work with us. If they've got if they want to get the results that they're
Yeah.
looking for.
It's hard for me. It's really hard to relate to your hand. So it's
Yes,
hard.
because most people, they have beautiful nails. You have beautiful nails. You
Thank
go and
you.
get them done. But a lot of these patients, it's a little bit difficult for them. And again, it causes a lot of depression for them, a lot of sadness for them. Not only did she have the sadness and depression before her psoriasis flared up, but following that, obviously, if your psoriasis is flared up, then it makes you even more depressed, you know. And so it's like a roundabout. You go
Yes.
around in a circle.
I know it's hard, but everyone, if they have the nail conditions, they need to give the priority for the time to relax, to take care of their nail first. At least they're not embracing in front of the people.
Yeah, that's right. But the important thing with nail psoriasis is that it takes a long time to get results.
Yeah.
Now, normally with psoriasis of the skin, you can get results in 6 to 8 weeks. With psoriasis of the nails, it normally takes about between 3 to 6 months to get some results.
Yeah, but it's good because I can see that after I came to clinic, the lady, she improved their nails after 2 months, isn't it?
Yes, there were improvements after 2 months, but her nails have continued to improve. And 10 months, 12 months later, she has very good nails.
Depending on the patient.
Yeah, exactly.
Yeah, thank you. Thank you, the professor.
That's okay. It's a pleasure.
Yes, me too.
Thank you.